everyone. Welcome to the Putnam County Library in another Lunch and Learn. And we have Trish and Laney here to talk about Medicare basics. Take it away.
Hi everybody, my name is Trish. I am with the Tennessee SHIP program. What we do is we offer unbiased Medicare consulting, things like that. Like if you want to change your drug plan, things like that, we help you find the best one, no charge at all. We also help you enroll, kind of get our opinions on things, and then help you make the right decision. Okay, so today is going to be the alphabet soup of Medicare. And the reason we titled this is because anything with Medicare is like a big bowl of soup. You gotta decipher it to get through it, things like that. So I've tried to make things as easy as possible and break it down a little bit easier so we all can understand it. So what is Medicare? Everybody knows Medicare is there we go. Medicare is the federal health insurance program for people who are 65 and older, people who have received SSDI for at least 24 months, or people with end-stage renal disease, permanent kidney failure, requiring dialysis, or a transplant. You know, different medical conditions can qualify you early for Medicare. Who manages Medicare? A lot of people think that like it's us sometimes, and we don't. It is actually the Centers for Medicare and Medicaid Services. It is a federal agency, and they are responsible for managing it, putting out the changes, kind of things like that that make the wheels turn, I like to say.
Excuse me, I had understood that there was scams was also being discussed today.
It is, that's what Lonnie's gonna cover too after
okay.
this. Yep, no, you're fine.
I just wanted to clarify if I was in the wrong place.
No, you're good.
I'm sorry.
No, you're fine. We're doing the Tennessee SHIP part first, and then I'll toss it over to Lonnie, and then she'll cover the scam part. So that was my fault. I should have covered that. What does Medicare cover? There are different parts of Medicare, and I know it's like different letters of the alphabet, but mainly original Medicare will cover your hospital, which is part A, and then your medical insurance, which is part B. There is also Medigap policies that kind of cover the in-betweens. And then there's Part D drug coverage, which everybody knows you have to have Part D, get your meds, things like that. And then you have Medicare Advantage. So here's where it kind of starts getting a little, confusing and things. You have options. With original Medicare, you have Part A hospital coverage, Part B medical coverage, and you can also add a Medigap policy and Part D prescription coverage. Now, with Medicare Advantage, it is an all-in-one bundled alternative. So it includes Part A, B, and typically a D. Many Advantage plans also offer extra benefits like dental, hearing, vision, like just kind of the extras and things like that. And where we come in is we kind of help you decide which path is best for you. Like if you're healthy and you don't go to the doctor and you take a med here and there, then we can point you in the right avenue. But if you're on the other end where you need the vision and the dental and all this, we can kind of steer you into what the right plans would be for that also. Now, your Part A is your hospital coverage. What Part A covers? Inpatient care in a hospital. Make sure that you are going to a hospital that accepts Medicare. Now, as far as I know, most every one of them do. There are some that do not, and it's kind of a few and far between type deal. Skilled nursing facilities, except for custodial or long-term care like nursing homes, that gets a little tricky. Hospice care and some home health services. So some home health will cover, Part A will cover some home health, some will not. It just kind of depends on how the home health service files it and things like that. Now Part B is our medical coverage. Now, it can cover doctor's services, outpatient care, and your medical equipment. Your knee braces, your walkers, things like that, and preventative services. So we have two different options. You have the medically necessary services, which includes your equipment needed to diagnose or treat your condition, and you meet the accepted standards of medical practice. And then your other one is your preventative services, which includes healthcare to prevent illness, such as the flu. They can detect it early when treatment is most likely to work the best. You can see down here a tip: check with your doctor to make sure your services or supplies will be covered. You can also log into your Medicare.gov account and search this information. If you don't have a Medicare.gov account, it's super simple. Go to the website, hit sign up, enter your email, it'll ask your information, and it'll create you an account. And you can view your status, your number, kind of things like that, and you can search for your doctors and stuff like that and know what the coverage is. Now, Medigap policies. Medigap is a Medicare supplement insurance that helps fill the gaps in the original Medicare and is sold by private companies. They can help pay your remaining healthcare costs not already covered by A and B, like your co-payments, your co-insurance, and your deductibles. So say you go to the doctor and Medicare pays 80% and you've got this other 20%. With one of these, with your Medigap policy, it would kick in and cover that 20%. So that's where it's kind of balancing out and things like that. Now, 6 things to know about your Medigap coverage. You must have parts A and B of Medicare. I get calls all the time, oh, I only have part A, like I need Medigap. Well, you have to have part B so that it can link together. Medigap will not give you the same coverage as a Medicare Advantage plan. You cannot buy a Medigap policy while you have a Medicare Advantage plan unless you are switching back to original Medicare. You can switch back, and Lonnie, correct me if I'm wrong, during open enrollment, right? They can switch from an Advantage back to original Medicare during your open enrollment times. Only one person can be covered under a policy. Your coverage is guaranteed renewable. And what does that mean? Meaning that as long as you pay your monthly premiums, the company cannot cancel your coverage. But the instant you miss a premium payment, they can cancel it and cut it off that day right then and there. Medigap does not cover prescription drugs. You have to have a Part D plan in order for that to cover with your Medigap. Now, there it goes. Your guaranteed issue period. The guaranteed issue period is a period of time where no Medigap company can subject you to medical questioning or deny you coverage. You may have a guaranteed issue period if or when your Part B becomes effective and lasts 6 months. You end your employer health benefits while eligible for Medicare. So if you're 65, you're still getting Medicare or you're getting insurance through your employer and that ends, then you're still eligible, then you can do that. And then during your first 12 months of your first Medicare Advantage plan, once your guaranteed issue period is over, Medigap companies have the ability to subject beneficiaries to medical questioning and possibly deny the basis of pre-existing conditions. So if you're gonna get in a Medigap, it would be best to do it within that first time frame so you're not having to go through all the other stuff and possibly get denied. Now, here's everybody's favorite part, the Part D coverage. This is one that we see more than anything. All insurance companies offering Part D plans must contain a wide range of prescription drugs that people with Medicare take. How do I know if my drugs will be covered? Every plan has a formulary, a list of medications that are covered, also organized into tiers. Example, you are likely to pay less in copays for a tier 1 drug and more for a tier 3 drug. Now, if you're sitting at home and you're on your phone and you're kind of wondering if your meds are covered, on the Medicare website, you can type in like your information, kind of what you're looking for, what drugs you take, the milligram and how many times you take it, and then it will let you do a plan option. It'll pull you the best options and what the coverage would be for those.
What do you type in? What?
So
Medicare?
when you go to Medicare.gov, and I'll pull it up when we're done, I'll pull up the website and show us.
Okay.
You can go to Medicare.gov and you can like act like you're gonna sign up for a Part D plan and then type in all your meds and how many times a day you take them and what milligrams. and then it'll show you the best comparisons, and it'll pull that up. But I have no problem pulling that website up at the end so you can see it. 5 things that impact your costs: what drugs you take, what tier your drugs are in, what coverage phase you're in, which pharmacy you use, and whether you get extra help. Number 4, I come across all the time when I'm doing comparisons, because Walmart can sometimes be cheaper than CVS. Food City can be cheaper than Publix. So it's just crazy how each place is different priced. And I've seen it where mail order is just the cheapest all the way around. Now then, our coverage phases. Everybody knows the donut hole. I'm sure everybody's heard about the donut hole. If you have not, we will talk about it. The cost before your deductible. What you pay in drug costs starting January 1 of each year. You stay in this phase until you have met your yearly deductible, which is up to about $505 depending on the plan. Now, after you do this, you will go to your cost after your deductible. What you pay after you have met your yearly deductible, and that's when your drug costs drop. Like March or April, if you've met all this and you're like, wow, my meds are like $1 now, what happened? Normally it is because you have hit your deductible and then you're in this phase and everything has now dropped down. Now your next one is the coverage gap, which is the donut hole. What you pay after you and your plan have spent $4,660. In this phase, you will pay up to 25% of drug costs while your plan pays $75. Drug costs are usually higher in this phase. A lot of people don't like the donut hole. They like to stay over here because this is where everything just kind of dips and goes back up again. And then your catastrophic coverage is what you pay after you have spent $7,400 out of pocket. I know, that's a huge amount. Once you enter this phase, you will remain here for the rest of the year. Drug costs are significantly lower in this phase. What I like about the Medicare website is when you get your comparisons, if you scroll down, it will show you what you have left this year, like where your coverage will be and if you're gonna hit that donut hole throughout the year or when you may hit it. So it's very informative. I think they've done a great job having all that information on the website. Now, here we're gonna do our Medicare Advantage. What is Medicare Advantage, or the Part C plan? It is health plan options approved by Medicare that is run by private companies. It is part of the Medicare program. Sometimes it is called Part C. It is available across the country and it provides Medicare covered benefits. And sometimes it may cover extra things. Now, how Medicare Advantage works. You receive services through the plan. All Part A and Part B services are covered. Some plans may do the additional benefits. Most plans include your Part D coverage. You may have to visit in-network doctors and hospitals. So if you have a doctor you absolutely love, but they are not part of the Medicare Advantage plan, more than likely you can't see them, which is the kicker. You can't see, you have to change doctors and redo all that stuff. And it may be different than original care, Medicare, with your benefits and your cost sharing. So there's the good and there's the bad. How Medicare Advantage works, you're still in a Medicare program. You still have your rights, your protections, all the normal stuff. If the plan leaves Medicare, you can join another Advantage plan, or you can turn to original Medicare. So if the company you're with says, I don't want to do this anymore, we're not going to offer this, here you go. Then you can join another Advantage plan, or you can just come back to regular Medicare. And we help do that. We help you kind of pick, hey, my coverage is ending, what do I do? So then we have you fill out an information sheet, and then we work with you on what the best options are. Now, Medicare Advantage and your costs. You still pay the Part B premium. A few plans may pay all or part of that for you. State assistance is available for some. We do have programs called LIS and MSP that can sometimes help pay the premiums and things like that. You may pay an additional monthly premium to the plan. Plan deductibles, co-insurance, and co-payments do differ from original Medicare. They vary from plan to plan, and again, if you go out of network, those co-pays and everything could be a lot higher. And you have an out-of-pocket spending limit. And everybody asks, who can join Medicare Advantage? To be eligible, you must be enrolled in a Part A, be enrolled in Medicare B, live in the plan's service area, be a United States citizen, not be incarcerated. To join, you must also provide necessary information to the plan, follow the plan's rules, and only be part of one plan at a time. So I feel like with the Advantage plan, there's a lot more rules, and you have to be a lot more careful with what you do. Now, everybody's favorite Medicare enrollment period, or as we like to call it, open enrollment, which is fastly approaching, is it not, Lonnie? We are getting ready. So the 7-month initial enrollment period, and how this works is you have 3 months before the month you turn 65, and then the month you turn 65, and then you have 3 months after the month you turn 65. So that's where they're getting the 7 months from. Your coverage will begin the first day of the month you turn 65. So if you turn 65 middle of September, it will start September 1st. So you will, even though you're not there yet, because of where your birthday is, it'll start that first. And then the first of the next month, and the first of the next month after you turn 65. There are no late enrollment penalties during this whole process. It's once you get out of the 7-month period that you have the penalties and things like that. Now, our general enrollment period, January 1st through March 31st. Coverage begins the first day of the month after you sign up. So say you sign up February 14th. That next month, March 1st, it will begin. If you've already turned 65, correct, Lonnie?
Yeah.
Okay. During the general enrollment period, you can enroll or join Part A and Part B. During this time period right here, your January 1st until your March 31st. And that's the same every calendar year, it does not change. Things to know about your general enrollment period. Use this period if you did not use your initial enrollment period for Part A or B. So if you didn't do it in that window, you can still do it here during this. Any late penalties for enrolling late will be added to your Part B monthly premium, 10% for each year without credible coverage. So if you go 5 or 10 years without it, you're gonna have a nice little penalty added onto it. Now, annual enrollment period, or as we call it, AEP. It is from October 15th till December 7th each calendar year. Coverage will begin January the 1st. Now, we get a lot of people that have turned 65 earlier in the year, they've tried their plan, they're just not happy with it. So then they come see us during AEP, and we can kind of help navigate them into something that will work a lot better. During AEP, you can enroll in Part D and a Medicare Advantage plan, Part C. So you can enroll in either. Yeah, either, not both, either. So Part D or the Advantage plan, you can enroll at those times for whichever one. Things to know about AEP, you can switch from a original Medicare to a Medicare Advantage plan and vice versa. So if you're on an Advantage plan and you're just not happy with it, you're not happy with the coverage or that you can't see certain doctors, you can swap back. But when you swap back, that coverage will not start until January 1st. So you're just kind of getting signed up for the next year and changing your benefits. Yeah.
So you're still covered though?
Oh yeah, you're still covered.
Okay.
You're still covered until December 31st. Mm-hmm. January 1st is when your new coverage starts. And that gives them time to send out your new insurance cards, things like that. So yeah, no, you're still covered through the end of the year. Your new coverage will start on the 1st. So you will not lose any coverage during that. And I get that asked a lot too. People think that they're just gonna lose coverage, and we're like, no, we're just kind of getting things ready for the next year. If you choose not to enroll in a different plan, as long as your current plan is renewable for the next year, it will automatically roll over. If you're happy with it and there's nothing you want to do different, it just stays. So you don't have to change. If you're happy with your drug plan and what you're paying and things like that, you just leave it alone. Now, Medicare Advantage open enrollment, January 1st through March 31st. First of the month after the plan gets your request. I don't know why I didn't highlight that because I didn't see it either. During Medicare Advantage OEP, you can enroll in a Part D or you can switch back to your Part C plan.
Switch to a different Part C plan.
Yeah, to a different
This
one.
is only for people that have Advantage plans already.
Yes. Now, if you don't have one, we have to do it at open enrollment, what we just covered. But if you have an Advantage plan and you're not happy and you want to try a different Advantage plan, this is when you do that. And we're able to switch it. You must be currently enrolled in a Medicare Advantage plan to use this period. And if you choose not to enroll in a different plan, your regular plan will just continue. No changes, nothing will be done. It'll just roll over and start just like nothing ever happened. Now, special enrollment periods. You may be subjected to a special enrollment period if your active employer health benefits are ending. If you're still working and your benefits there are ending, then you might be able to get a special enrollment period. You move permanent address to another service area. So if the area you're in has coverage, the area you move to has coverage, but it's not the same, then you can do that. If you are admitted during stay and discharged at a long-term care facility. If you're eligible for Medicaid or low-income subsidy. Other special circumstances such as a federal employee or representative providing you incorrect information. And I like to think of that, Lonnie, as these phone calls that you get saying, oh, we can do this and we can do that, and they trying to get you in there and it's been a scam or they've signed you up for something you didn't even want. That's when we can come in and be like, okay, listen, this is what happened. Let's get it fixed. Now, here is our low income assistance programs, or what we call the extra help programs. Our LIS program lowers your prescription drug costs and it lowers your Part D monthly premium. And then MSP is our Medicare Savings Program. You no longer pay a Part B monthly premium. You may be eligible for assistance with Parts A and B co-pays or co-insurance. You will not have to pay any sort of penalty fees for enrolling late if you're on this program. Now, here are the eligibility guidelines. Your LIS monthly income limits. If you're single, it is $18.82 before deductions. If you're a couple, it's $25.55 before deductions. Now your resource limits, $17,220 as single, and then as a couple is $34,360. If you are in that range, then you could possibly cover or qualify for the LIS system. Now, your MSP program, there's 3 different options. There's your QMB, your SMLB, and your QI1. Now, for QMB, it's $12.75 before deductions if you're single. As a couple, it's $17.24 before deductions. Your SMLB is $15.26, and a couple is $20.64. And then your QI1 is $17.15 before deductions, and your $23.20 before. Now, I have seen a lot more QMB than I have the other two, but I'm still getting in the ballpark of all this. So, and then over here you have a couple is your $94.30, or I'm sorry, your single is your $94.30, and then your couple is $14,130. So if you were in these limits, you could qualify for one of these also, if your income is in that area. And those are the ones that provide the extra assistance, co-pay assistance, things like that. So with that being said, does anybody have any questions for me on anything I covered? Oh, this is Lonnie. We're gonna switch to Lonnie.
One question.
Okay.
You said there's sometimes special enrollment is if your employment has quit.
Mm-hmm.
Yes.
But you are assuming you must be 65 to be in that. if you're on COBRA and you're losing that 2 months before you get 65, I can't do anything about that, can I?
Did you have employer insurance? When
I
did your
did.
employer insurance end?
It ends November 11th,
And when do you turn 65?
February.
Okay.
That's one of those that there's that.
Oh,
So the thing I would probably suggest with you to see if you could do between, since your COBRA is ending, cause you don't turn 65 until February, correct?
right, and I've had COBRA for 3 years.
Okay. I don't know if you can extend that, or if maybe for the couple of months you can go on to the healthcare.gov and get one of those, Obama plans.
Just temporary
Temporary.
until.
I don't know, but you don't, since you don't qualify for Medicare until you're 65.
You can't bridge it, can you?
No.
Okay, that was my
Cannot.
question. There's no little bridge there.
There is no little.
I wish there was. Otherwise, more people could
Mhm.
kind of comp that time. But yeah, you would have to go and get get insurance temporarily until you're able to enroll in Medicare.
Yeah, cause you can't, there's only certain times you can sign up for Medicare. One of them is when you have to be 65. The other one is unless you're on Social Security disability for 2 years. Or the other one is if you're in stage renal.
Mm-hmm.
That's pretty much the only 3 ways that you can get on Medicare. So you have to find something, I don't know, like a private policy, something
Yeah.
like that, just for those couple of months until you can get work done without. I don't know. I don't know.
No, we
I know.
cannot do
I
that.
know.
No, not at all. Not at all.
So either private policy with some like Farm Bureau or
Mhm.
other
You have
type
to
of,
totally well to do Farm Bureau.
I know Blue
or
Cross
the
Blue Shield
healthcare
has
has
some.
yeah, Blue Cross Blue Shield has some,
I may
healthcare-
see if they
check-
can
check the
extend my Blue
healthcare.gov.
Cross, Blue Shield. I've had this policy for, 24 years,
let me see if they have a private
piece of it,
piece
okay?
Mhm.
of it.
If they have like a private part that will just
It's
get
telling
you
you
to
you only
February.
need it for a couple of months to
Yeah.
get Medicare. So is it just covering you or is it covering other people?
It just covers me.
Okay. It may not be too bad then if it's just
Yeah.
you.
No, she's lucky, she's Q and B, and we
Yeah.
will
That's
do
what he
nothing
Good.
to,
Yeah.
That's what he's saying.
do away with that.
That's good.
That's what,
Yes, it is. Okay, well, I'm going to turn it over to Lonnie.
Thank you. Alright, so the Senior Medicare Program. I'm Lonnie Hitchcock, and the Senior Medicare Program actually deals with Medicare fraud, and the scams that's going around. So, so, pretty much that's what I do. I go out and educate beneficiaries about Medicare fraud and scams. So, there's my mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So there's my lovely mission. Alright, so some examples of fraud that I deal with on a daily basis. Billing for services or supplies that were never provided. A couple of months ago, there was a scam going around where who knows how the scammers got a hold of their Medicare beneficiaries' numbers, but they were charging for urinary catheters on their statements. Like they were coming out on their statements, but the beneficiaries never received those supplies, never even needed those supplies. So, but they were showing up on their Medicare statements where the scammers had charged Medicare for those, and they were like in the thousands of dollars. And they were doing multiple months of it was like 200 urinary catheters per month, and they were doing that multiple months. So, they were, don't know how they scammers usually, they're either getting some of these numbers through like data breaches and things like that. So, or on the phone calls that seniors get, and you all know seniors are getting tons of phone calls. You're probably already started, and you're not even, they usually start like 6 months before you're Medicare eligible. You're starting to get mail and phone calls and things like that. So yeah, it's from some reason, like when you turn 64 and a half and you go on some type of like
Mailing list.
mailing
Bam,
list
there
or
it is. Yeah.
phone call list, I don't know, but it just automatically happens sometimes. So other ways that I've been dealing with is obtaining or giving a Medicare number for quote free services. One of the scams is going around right now is they're calling claiming to be from Medicare, and that Medicare is offering you free braces in order to get for your Medicare number. In order for you to qualify, you got to give them your Medicare number, but you qualify for free braces, back brace, knee brace, whatever joint may be hurting you, they will provide you with a quote free brace. Of course, these are not free because they are charging Medicare for them. Claims are for services that are not medically necessary. We've gotten tons of these sometimes all the time. Doctors sometimes will prescribe stuff that you really don't need. I had one beneficiary where every time she was going to the doctor, and for some reason the doctor was always doing like an MRI or anything, just out of the blue, even though she didn't need it. Another one, some examples of using another person's Medicare number or letting someone else use your number in order to obtain medical services. So if someone, and we've had this sometimes where people have letting them use their identity or whatnot to get services when they don't qualify for, and that happens sometimes in Medicaid, so it's Medicaid or Medicare, both. A lot of things that I hand out is this Medicare summary notice where you can keep track of your statement or keep track of your Medicare. So you can compare your statements. I highly encourage beneficiaries to read their statements every year, every month that you get them or when you get them. So there's two different types of statements that Medicare comes out with. If you're on a Advantage plan, you get something called like an explanation of benefit. If you are on original Medicare, you get a Medicare summary notice. Those Medicare summary notices only come out quarterly, unless you have your own Medicare.gov account where you can actually see the claims in real time. So if you're on a Medicare.gov account, you get a username and password, and you can actually see your claims in real time in that. But keep in mind, so if you do sign up for original Medicare, the Medicare summary notices only come out quarterly. They don't come out as soon as they get processed. Now, if you're on an Advantage plan, they do pretty much come out as soon as they get processed. So you got those. But I highly encourage beneficiaries to use these. These you can keep track of your doctor's appointment. So like 6 months down the road, when you finally get your Medicare summary notice from that doctor's appointment, you'll know what happened during that doctor's appointment. Like if they took blood, anything like that. So this will help you keep track of those. It's a real handy little tool that I hand out. So definitely highly encourage everybody to read their Medicare statements. So some ways to prevent fraud. Definitely, there's tons of phone calls that you all get. Do not give out your Medicare information. Don't give your Social Security number out. Don't give your Medicare number to these unsolicited phone calls that you get, because I know y'all get so many. None of the federal agencies call people. Medicare doesn't normally call people. Social Security doesn't call people. None of those normally call people. They communicate by mail. So one of the other scams that's going around is they're calling claim to be from Medicare. Want to know if you've received your new Medicare card. Medicare is not sending out new cards right now. Medicare had sent out new cards back in 2018 when they changed from your Social Security number based to another Medicare beneficiary identifier number. It's a 11-digit combination of numbers and letters. That's the only time that Medicare has sent out new cards. So this scam that's going around, I said Medicare, they're calling claim to be from Medicare, wants to know if you've received your new card. And then they need your number, they need your Medicare number to see if they have sent it out. That is a scam. Do not give your Medicare number out, please. So another thing I said, be wary of any unsolicited phone calls. So anything. You cannot even trust your caller ID now, because they have spoofing technology where they change the number that pops up on their caller ID. It is not where they're calling from. they do that because they'll change it to a local number, because they know that you're more likely to answer a local number than you are a long distance number. So that's why they change it. So you can't trust your call ID. So keep that in mind. Rely on government websites or emails for unbiased information. So go to these and make sure if it's a government website, it will always have .gov after it. Social Security, it's ssa.gov. Medicare, it's medicare.gov. If you go to medicare.com, that is actually an Advantage plan company. They're selling Advantage plans. Yeah, so it's not Medicare. It is an Advantage plan company. Request translation or assistance services if you need it. So if you need it in a different language, anything like that. Confirm everything with an agent. If you actually talk to an insurance agent, if you have your own insurance agent, confirm everything before you sign up. Because there's some agents out there that will lie to you, try to get you to sign up. Because they work on commission. We do not work on commission. Because they get like $600 for signing someone up for an Advantage plan. $600. That's a lot. Especially if they sign up more than
Per person.
per person. Yeah.
Per person they sign up, they get that $600.
Yeah, that's a lot. So Advantage plans, so you gotta be careful with agents out there. Make sure you do your homework before you sign up for an Advantage plan. Make sure all of your doctors accept that plan. So if you wanna switch to an Advantage plan, yeah, you need to make sure all your doctors, the hospital, any nursing facility you may go into, the ambulance service, any service that you might use, make sure they accept that Advantage plan before you sign up. Be aware of your rights to choose how you receive Medicare coverage. She went over some of those. Do your homework before signing up. I've already said that. Ask your physicians, hospitals, DME suppliers if they take that plan. Another good thing, check the plan star rating. Because it's rated. So just to make sure it's a good plan. You don't want to pick a 1-star plan. So Medicare does rate those on the Medicare.gov website. So you can see the star ratings on those. So other scams that I've been dealing with, I'll just go over some of those. So I've already told you about the brace one that's going around, the Medicare card one that's going around. Another one that they're doing is they're sending out DNA testing kits. The cheek swabs, where you can test for hereditary cancer, autoimmune diseases. It just multiply. They come up with all sorts of different things that suppose they can test for. But those tests actually cost Medicare millions of dollars. $1,000 per test. And
So how do you receive those, in the mail or?
yeah, they're sending them in the mail. Like you'll get something in the mail. Sometimes it's from a phone call. You'll get like a phone call when it's for those quote free services that Medicare can do a genetic testing heredity kit to check for cancer, autoimmune diseases, anything like that. And then they'll send you a cheek swab test kit in the mail, but that's how they use it. And the braces come that way also. They'll usually send them in the mail, or they're delivered through UPS or FedEx or something like that. But sometimes a box of braces will show up at your door. The genetic testing kits will show up in your
But if that
post
happens,
office.
what are you saying, that all of that is a scam?
Most of the time it's a scam because
But
your
if
doctor
it
hasn't
shows
ordered it.
up, what do you do?
You don't do, call me. You call me.
Oh.
My number is actually on the back of this because it needs to be reported, so that I can report that company. So if you getting anything like that in the mail, definitely don't take the because most of the time your doctor hasn't ordered it. Or if you do these tests, they don't even send you the results or anything like that. They just charge Medicare for it. Who knows if they've actually did the test. Sometimes they just charge Medicare for the test that you never did. Or as I said, they don't send them to your doctor. So or your doctor hasn't even ordered them. Yeah, so that scam changes a lot.
So
Yes.
they never call, I got a call the other day about dual complete, where they wanted to send a health worker to the house to check her vitals and to see if there's any benefits we should have been getting that were not.
Mhm.
Would that have been a legit call or not a legit call?
Who was calling? Was it her Advantage plan?
She has dual complete,
Which one?
TennCare, Medicare, United Healthcare.
So she's not United. It could have been United calling. Sometimes they have those, but what they do is they'll send out nurses send a nurse out to their house to check her vitals and stuff like that. You do not have to do those, but they will charge the Advantage plan for that service.
Okay.
But with her being a dual complete, she has everything she needs
And more.
and more. Yes, so she's good.
So this 800 number is what you would call?
Yes, my toll-free number is back there. So if you find anything on any of your Medicare statements for services you never received, anything like that, got any freaky phone calls, please let me know. Cause scams change all the time. I just told you the main three ones that I've been dealing with here lately. The brace one, the Medicare card scam, and the genetic testing one. That's the three main ones that I have been dealing with here lately. So just be careful of any phone calls. The genetic testing one, the back brace one or the brace one, and the Medicare card scam where they call and claim to be from Medicare and wanting to know if you received your new card. That's the one I've been getting. You got that one?
I've gotten a lot of calls and I just tell them, thank you, I'm happy with what I have.
Yeah.
Please
Just
take me off your call list and I hang
They're
up.
not gonna take you off your call list because they're criminals.
Yeah.
So they're not gonna listen to
I
you.
know, but
Yeah.
I'm trying to be polite.
Yeah, no, you don't have to be polite.
Don't
It's
be
okay.
Well,
These are criminals. You don't have to be polite.
I know we've told people when they've said that, and if it's like a robot call, don't say yes,
Yes.
don't say,
Because they're recording you now.
they are recording your responses so they can edit it to make it sound like you agreed to it. So don't state your
Yes.
name, don't say yes, don't answer.
Just the best thing that I can tell you to do with these scam calls, if you do answer them, just hang up. Don't talk to them. The other best thing I can do is use your caller ID. If you don't recognize the number, even if it's a local number, do not answer it.
I don't.
Because if you keep answering it, they know they have a live person.
Mhm.
So they will keep calling back and they will harass you to no end. So if you don't recognize the number, don't answer it or let your voicemail or answer machine pick it up. Let them screen your calls because you can't trust anything nowadays, even your text message. Because scammers have now started text messaging, emailing, all forms of communication now you cannot trust.
They'll even probably Facebook message you sometimes too.
Yeah, they'll Facebook message you, they'll go through Facebook. They're sending texts now, they're sending emails. You've got to be careful. So think before you click. Don't answer it if you don't recognize the number. That's just some things that I can tell you to do to help prevent some of these scams from you falling victim to some of these scams. And there's all sorts of different scams going on right now. I know the Attorney General's office just put out one where they're claiming that your Social Security number, or that something about your Social Security number and something with
Your benefits are being held.
your benefits are being that, or the other one is that somehow your Social Security number has been associated with some type of drug shipment or something like that.
Yes, I've
I've
That
heard
was
seen
just
that.
going around. There is all sorts of scams going around right now, especially targeting seniors because you are a vulnerable population. So you've got to be careful. You got to protect yourself.
And I've heard some of the ones where your social security number has been compromised. We have froze your social security
Yes.
number or canceled it or something.
Yes.
Call us, and I'm like, you can't do that. Like,
Yeah.
you can't cancel my social.
Don't call
so
any numbers
yeah.
that
Don't do that.
look up Social Security Administration and call that number that's on the website. Don't call back any numbers that they text you or anything like that or tell you to call back.
And if you are on Facebook, we do have an SMP Facebook page
Mm-hmm.
where Lonnie's really good about putting you scams and updates and things like that. We also have a Tennessee Ship Facebook page
Mhm.
where we share those updates.
Yeah.
So if she
They do like
posts
a
it,
Medicare Monday thing.
yeah, we do all that kind of stuff. Any updates happening. If she posts a scam, then I get on there and I share it so that everybody else can see it also. So we try to stay very up to date and keep everyone informed as much as possible.
So what is your organization?
She's with the Tennessee SHIP, and SHIP stands for State Health Insurance Assistance Program.
Now, the development district?
Yes, we're out of the Development
District is where
And
we both
I'm
are.
with the SMP, the Senior Medicare Patrol. I deal with Medicare fraud is the main thing that I deal with.
So I deal with the signing them up and educating and those kind of things, and she does
I deal with the fraud.
scammers and all that. So
I deal with the scammers and the fraud.
but we are both in the UCDD, so
Okay.
we are both there. Yes.
And your department's called what?
The Senior Medicare Patrol.
Senior Medicare Patrol.
Yes. I am actually a statewide, so I go out across the state and do presentations like this.
And then I cover, well, my team,
You cover-
our team
yeah,
covers the
covers
14
14
counties.
Of the upper
Of
Cumberland.
So
the
are
upper
you the
Cumberland.
only one?
No, thank
Not
goodness.
now.
Not now. I was
She
the only
was.
one.
Yeah.
but No, I have help now, so.
They finally brought somebody in to help her. Yes. Yeah.
Yeah. So, all right, any other questions? Y'all got some good questions.
Mhm.
Anything Medicare related, fraud related, scam related?
Wish I could have been at this before I had some issues.
Well, you know it's now, so if you have any
That's right.
issues in the,
I think the more
And-
you can put this out to the public, the better.
yeah.
Mhm.
So if you're needing SHIP's toll-free number, it's on the back of this. So if you didn't get one of these, SHIP's toll-free number is on the back of this, and SMP's is on the back of that also.
Yes.
There was that lady I talked to with dark hair.
Sarah.
Sarah helped
Sarah.
us.
So I
No,
have,
they're not that
You're
kind
a
of
new
time.
hire.
I've been here since, you can kill it if you need to.